Hey, this is Aaron Shaw with another edition of Coach's Corner. This is our weekly newsletter on some tips and tricks to help you stay as active and healthy as possible. And today I wanted to come to you with a couple of tips to fortify the tendons in your elbows. So I've spoke about this at least one other time and generally regarding tennis elbow or golfer's elbow, which is tendon inflammation and tendon damage on either the outside for tennis elbow or the inside of your elbow, which is golfer's elbow, as a result of exercise. So I've dealt with this myself from doing, overloading my tissue. Just long story short, it's overloading the tissue. And there's this really unfortunate phenomenon with strength training and exercise, and that is that your muscles adapt faster than your tendons. So with the best of intentions, you start lifting weights, you're doing maybe bicep curls or tricep extension or rows, and so you end up doing a lot of pushing and pulling through force that's transmitted through your hand into your forearm, and all of that force ends up loading the muscles of your forearm, but also the tendons that attach to your elbow. So the good news is that muscles get great blood flow, and with healthy nutrition and a continual slightly increasing demand of workload, your muscles will get stronger. Depending upon your nutrition and how you're dosing your exercise, they may also hypertrophy. You may also get bigger muscles, if you will. But that happens fairly quickly on the scheme of things. Unfortunately, the tendons, which attach those growing stronger muscles to the bone, they are really slow to adapt. So there's this imbalance where as your muscles get stronger, but your tendons kind of lag behind, and as you're lifting more, pushing more, either the amount of resistance or the number of repetitions and set and overall volume, sometimes the muscles are ready to go, the tendons can't tolerate it, they get micro trauma, which is a little bit of tearing of the tendon tissue, which leads to pain, inflammation at the tendon site, sometimes loss of motion because it hurts so badly, and dysfunction, so you have to stop doing what you're doing. So I want to show you a couple of exercises that you can do and should really think about integrating into your exercise routine, specifically to make sure that the tendons are trying to keep up with the exercises that you're doing in your general strength training routine. So the first series of exercises are what I call, or what are known as bell sole exercises. So you can use just an exercise ball, or if you're into devices, my favorite one here is the VeriGrip by Dynatomy, which is a hand gripping exerciser. But this is just a stress ball, if you will. So the idea of this is to repeatedly put stress across the tendons of your elbow in various positions in a controlled manner. And what this allows you to do is really thoughtfully ask the tendon to get a little bit more tolerant for stress, knowing that because of your strength training routine, your demands are kind of gradually increasing, and it kind of helps bring your tendons of your elbows along through this journey of strength training. It's also, these are some of the same exercises that we issue people who come to us injured. So if somebody comes to us with a diagnosis of tennis elbow or tendonitis of the elbow, these are some of the same exercises that we often give. Now, what I can't do on this video is diagnose whether you have whether you do have tendon issues at your elbow, and certainly every single person that we see with some sort of condition of their elbow, we treat them absolutely differently because everybody's on different phases of recovery. But these exercises nonetheless will be helpful to add into your routine, maybe twice a week, maybe 3 times a week. So let me show you what they are. So this first exercise, again, call it bell sole exercises. You're gonna get a gripper. Your elbow is going to be at 90 degrees and kind of just by your side. And what I want you to do is to squeeze this ball as hard as you can without increasing any sort of discomfort. You're going to hold that for 2 or 3 seconds, slowly relax, ramp it back up again, hold that 2 or 3 seconds, slowly relax. So you're going to ask for a high demand load without kicking into the pain zone. If you happen to have pain, if you don't have pain, go ahead and squeeze as hard as you want, hold it, release. So by doing this, you are putting measured stress and demand on this tendons, and you can control it and really finesse it, which is harder to do if you are in a big bench press motion or through a curling motion. You may have pain somewhere along there, and it can be hard to kind of dissect out, but here, if all you're focusing on is gripping, you can really kind of tell what's going on. So with this exercise, there's various positions you can put your elbow in, your forearm and hand in. So I always start with elbow by your side at 90, and then you can work on rotating your forearm, try a few squeezes, kind of in this mid position, and then try a few squeezes with your palm down, and then also doing some with your arm straight by your side. So what I like to do, again, generally speaking, is when I issue these to clients, doing 3 or 4 repetitions in various positions, hard as you can, without increasing pain. Pause for a second or two in between each repetition, and then let it go. Just like any other exercise, you can overdo it, and it can really make symptoms a lot worse if you're not careful. But that is a good way to provide measured demand, measured stress across these tendons of your elbow. And again, it's from somebody who suffered with tennis elbow on both sides at the same time. At one point, this became a savior for me and really kind of helped me rehab, and now I kind of keep integrating that into my program. And so far, so good. Haven't had any flare-ups from that. The other exercise to consider, if you get a dumbbell, and a lot of exercises, of course, will be curls. So curls or even wrist extensions sometimes to strengthen the forearm. One of the ones I like to do is taking this weight and placing it on a table or even across your knee, and holding the weight. This is 5 pounds, which is plenty to start with. First of all, making sure you can hold this weight without any discomfort. And then if that feels pretty good, what you can work on is actually moving your body so your elbow ends up moving, your wrist isn't moving at all. And by slowly moving back and forth, the tendons at your elbow are under load, they're under stress, static stress. It's because it's just 5 pounds, it's not going anywhere, but your body's moving around that load. So this can come in handy to, I don't want to say teach your tendons, but get your tendons to adapt over time to tolerate this, load with elbow motion, which is kind of what happens when you're pulling something, and even when you're doing a bicep curl, because really your wrist isn't typically moving. It's your elbow that's doing all the movement, and by doing this, you can really isolate exactly the tendons of the elbow without worrying about what's going on with the wrist. Alternatively, you can do this palm up, same exact thing. You may find when you're further away, or the straighter your arm is, that may start to kind of get closer to the point of being uncomfortable. So you kind of like gauge how much range of motion you have with that. With the straighter your arm is, the more stretch there is on the muscle and tendon. And if there's irritation, that's typically when it's going to happen. So you can always shorten that range of motion. Of course, lower the load, lower the weight in your hand. And alternatively, with both the gripping and the dumbbell exercise, if it feels good, you can do more weight, add more resistance, do more repetitions. The key with this is a couple of days a week is plenty, 2 or 3 days a week. I would say for this bell sole, the gripping exercise, 3 or 4 repetitions and a couple of variety of positions until you get a total of maybe 12 repetitions in total. Rest for a minute or two and go through that series again. That's plenty. For the dumbbell, moving your arm back and forth, I would say, since it's kind of several movements with this, you can almost use time as a guide as well. So you could even do 30 seconds in one, 30 seconds in this position, rest, and 30 seconds with your palm up in that position, rest. Go through that 2 times. That should be plenty. As long as you have a well thought out exercise routine, generally speaking, this is a great way to fortify the tendons of your elbow to make sure that you can engage in life, not only with weightlifting, but tennis, golf, picking up groceries, picking up your kids. Because I can tell you from first-hand experience, again, when your elbows are painful, it affects every little bit of your life. So give these a try. As always, if you have any questions about this exercise or any others, reply to this video, let us know. Your physio coaches are here for you. And also check out the link that's associated with this video to a free report on dealing with tennis elbow, dealing with elbow pain. So I've created a report that's super simple, a couple of things that you can do to make sure that A, to avoid it, and B, if things start to flare up a little bit, what you can do to take care of that. So until then, keep up with the exercises.